Well, we talked about two of the hot areas that are active today, right? The administrative side of healthcare and continual care. But some of the areas where new technology is hitting the market right now is in prevention, diagnosis, and therapy. And I know you've looked at the prevention side of things, Ned, and how conversational AI is changing the let's make sure you don't even go to the hospital to begin with.
Yeah, no, we've looked at that quite a bit. And, one of the funny things about the incorporation of technology into healthcare is people going to Dr. Google, where it seems like every time you look anything up, like I have a splinter in my finger, what could this symptom indicate? And it always comes back with something like brain cancer. And so if you were to always look at Dr. Google, you'll end up in the emergency room for everything that happens, which is obviously not the correct answer. And wouldn't it be better if you could call and talk to the triage line at your local doctor, but that's a conversational AI? Do you have a fever? How long have you had it? Are you throwing up? Are you not? Whatever the questions are that you would need to determine the severity of something, and then have basically the set of requirements or a set of recommendations. For my kids, the pediatrician office has a very pragmatic person who's on a triage line number, and they're hard to reach because everybody always calls up with the same questions, which is, look, my kid swallowed an anvil, what do I do? But if you could have a conversational AI with the 15 most common cases, like look, Timmy has a runny nose, do I have to be worried? Well, do they have a fever? No, probably not. Or whatever it is, I think that would save a lot of time and heartache. I would love to have that service immediately.
I want one that just always says leprosy. Like that would be cool, right? No matter what. A number of products that are hitting the market, and you kind of are talking about the diagnosis side of healthcare. And there's one product, and you can go out and find out which one I'm talking about. But it'll go through a structured Q&A session, as you mentioned, Ned, with the patient, and it's got 700 diagnoses that it'll go through and kind of hone in on what you've got. And then the big thing is, do you need to go to the emergency room? Do you need to make an appointment? Or a good stiff martini might help you out and just chill. But that's kind of the brave new world. That's where things are heading on the diagnosis side. I think that's going to become a little more well honed.
Funny enough, every time I use that system, it tells me to put brown liquor in a glass, sometimes with ice and sometimes without. And I always follow that recommendation. It works great.
Yeah, that's your two options, with ice or without, right? Your kids followed an anvil? You like taking a road runner or something like that? What the heck?
I couldn't think of a more ridiculous example on the bounce there, so I just went with anvil.
You totally succeeded.